Hello and welcome back to PIs Today podcast. I'm your host, Dr. Nick Laloy. We're back in beautiful sunny Oakland, sitting out here and doing some interviews. Today we have a special guest with us, Dr. Andrew Vargas, MD, pain management specialist. Doc, tell us about yourself, your training, what you have to go through, and all the hard work and sacrifice to become the fine gentleman that you are today.
Hey, thank you so much. Thank you so much for the opportunity to be on today.
Of course, my pleasure.
Grew up, I had no idea I wanted to be a doctor up until about college time. I went to the University of Georgia, and probably about my third year, when I was in a biochemistry major anyways, I decided hey, you know what? I just want to get in and help people. I kind of want to really be where the tire meets the road, talk to people, learn their story, and just try to help them out. So I took an extra year. I got a degree in biochemistry and molecular biology. I got a second degree in cellular biology. I took a little bit of time just to teach some MCAT classes, try to craft a good application for medical school before heading up to Milwaukee, Wisconsin at the old Marquette, the Medical College of Wisconsin. Studied there. I was top 6, I want to say, in my class. We had this AOA organization for students who commit a lot of time studying, get good grades, interact well with patients. Graduated there in 2015 before I went off to the University of California, San Francisco to do an anesthesia training for the next 3.5, 4 years. Pain management training for an additional year. So I finally finished in 2020 after graduating college in 2009.
Okay, wow. That's a long road, and as the viewers are familiar with pain management, Doc, some of the things that you do, you put in lumbar spinal cord stimulators.
That's right. Yeah, I do handle neuromodulation cases. So
Okay.
patients who have a lot of radiating pain down the legs, like sciatica, who may have had a surgery already that didn't fix the problem, can be a good fit. Patients with diabetic neuropathy or other types of neuropathic pain, for example, after an injury, can also be really good candidates for this.
That's amazing. And CRPS?
Complex regional pain is a great indication for it.
That's right. And some of those diagnoses I've seen through my career that are very much so missed. They are they mimic sciatica, and a lot of doctors miss them. So, how would you say you would differentiate between a sciatica nerve pain and a CRPS? Of course, the mechanism of injury has a lot to do with it, but how is it so frequently missed?
So some things that we look at that can seem a little bit strange would be, is there a lot of swelling in the extremity? Is there changes in the pain intensity? For example, just putting a sock on, not something that's supposed to be painful ever. That can be extremely painful in complex regional pain syndrome. We call that allodynia. Other things that we look at are there color changes or any changes to the musculature? Is there atrophy? Is there any type of sweating changes or other changes in the sympathetic nervous system? And oftentimes we do diagnostic injections involving sympathetic nerve blocks to try to help diagnose and potentially treat it.
Yeah, very smart. And you were telling me about PRP, and some patients are very highly sensitive to corticosteroids, or maybe you get better results with PRP in injecting it in the joints, in the spine joints. Tell us about that.
Yeah, I think PRP is actually a great option, not only necessarily for patients who shouldn't be getting cortisone injections, like your really brittle diabetics or people with glaucoma or very difficult to treat hypertension, cardiovascular disease, renal disease. There were actually guidelines that came out last year, or in 2024, from the American Society of Pain and Neurology, actually suggesting that in many cases, PRP is not inferior, so it works just as good as cortisone.
That's amazing.
Yeah, it can even last for longer than cortisone.
Amazing.
Reducing the need for coming back for repeat injections and helping with rehabilitation.
Absolutely, and that's I guess the scholars like yourself pushing medicine forward and making sure people have the best outcomes. Your locations, docs, are in San Mateo, Daly City, San Jose, and Sacramento. You cover pretty much a very nice part of Northern California. We are very, very happy and indebted to you for taking care of our patient lives in the PI community. It's a very under-covered community, and you take your time, and we really, really thank you very much for putting your time out there.
Yeah, thank you very much, and I love having the opportunity to help people get back on track with their lives.
Very good, Doc. Thank you for joining us.
Great.
Take care.
Thanks for listening, PI Today podcast, sponsored by Trauma Cash, Global Lean Doctors and TBI Analytics. You can find us on our website, www.pi2daypodcast.com, also on Instagram, YouTube, Spotify, TikTok, and LinkedIn as PI 2 Day Podcast to watch all our episodes. See you next time.